Good morning. It's Monday, March the 16th, and we at LCHD would like to take this opportunity to update you on COVID-19. You may also see or hear this virus referred to as SARS-CoV-2. First and most important, this is not a time to panic. It is a time to educate yourself on the virus and what you can do to prevent its spread. What makes this virus so unique? COVID-19 has never before been known to infect humans. Thus, many questions remain regarding how best to understand its threat, how to prevent its spread at this early stage, and how to treat it. This is what we know so far. COVID-19 spreads mainly from person to person, between people who are within 6 feet of each other. The virus spreads through respiratory droplets produced when an infected person coughs or sneezes, and these droplets can land in the mouths or noses of those who are nearby, and they also can be inhaled into the lungs. Another way this virus can spread is from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or an object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. At this time, current data shows a person can spread the virus up to 2 days before symptoms appear and for 14 days after symptoms start. Symptoms of mild disease include cough, congestion, cough and runny nose, fever, fatigue, body aches, and shortness of breath. At this time, testing for COVID-19 is very limited and restricted to only the following individuals. Number 1, hospitalized patients who have signs and symptoms compatible with COVID-19. Number 2, those exhibiting symptoms with high-risk chronic conditions such as lung disease, heart disease, cancer, and immunocompromised conditions, also in pregnancy. Number 3, healthcare providers at increased risk for exposure. This means we here at LCHD, including each of our clinics as well as the hospital, and the clinics in surrounding areas cannot, I repeat, cannot test for COVID-19. We can only screen patients presenting with symptoms. In an effort to safely screen ill patients, protect the well population, and protect our healthcare team members, we have certain procedures in place for all to follow. Number 1, if you or your loved one is ill with respiratory illness, call the clinic. Do not come in. Mildly ill patients are encouraged to stay home and contact their healthcare provider by phone for guidance about further illness management. Number 2, patients who have severe symptoms such as difficulty breathing should seek care immediately. Number 3, older patients and individuals that have underlying medical conditions or are immunocompromised should contact their medical provider early in the course of even mild illness. LCHD has set up a triage isolation clinic to better serve those suspected of having this virus, all the while protecting the well from possible exposure. It is best practice to call ahead for pre-screening by our exceptional frontline staff. During clinic hours, call the Family Wellness Clinic at 806-998-4604. After clinic hours or on the weekends, call 806-561-2076 for direct access to nursing. Currently, the triage clinic will be located at the Family Wellness Clinic across from the Allsips. Access will only be granted through the clinic's east front door. Signs are posted on the glass doors for more clarification. Anyone coming to the clinic or hospital with a cough or respiratory illness will be asked to put on a face mask. No exceptions. If you are a visitor with cough or respiratory illness, you will be asked to leave. Entrance into the Linn County Hospital will be restricted starting today. Please pay close attention to signs at this facility, which will further guide you on appropriate entrance points, and stay tuned on Facebook for updates. Please be looking for announcements in the near future on the LCHD Hospital, as well as Linwood Assisted Living Center visitor restrictions, including the closing of the LCHD cafeteria to the public. We understand the seriousness of these restrictions. However, the safety of our patients, employees, and community are our top priority. Please understand the guidelines may change as we get updated information from the Centers of Disease Control and the Texas Department of Health and Human Services. Included on Facebook will be a link to the updated CDC guidelines, which may be able to answer and further direct your many questions.